NACDL is the association of the nation's criminal defense bar.
My name is Dr. Mark Kiselica, and I have the privilege of welcoming you to today's conference in my role as the Director of the School of Behavioral Sciences and Education here at Penn State Harrisburg. As we begin this day, I want you to know that my interest in today's conference extends far beyond my duty to offer some official welcome remarks. You see, I happen to be a psychologist, and the topics that will be addressed today have been important to me since I was a young man, which seems like a lifetime ago, back in the 1980s, when I made a decision to dedicate my professional life to helping troubled boys. After I graduated from college, I took a job as a mental health worker on an inpatient adolescent psychiatric unit where I worked closely with boys and girls who had substance abuse problems. I also spent many hours subbing for other workers on the hospital's 2 adult substance abuse treatment units where we were serving a growing number of people who were addicted to cocaine and heroin. Through those experiences, I witnessed firsthand how opioid addiction could ruin lives, fracture families, and contribute to a variety of crimes in the community. Since that time, like many of you, I have observed with great concern a steady rise in opioid overdose deaths, which occurred in 3 waves, starting with an increase in deaths due to overdoses involving prescription opioids in the late 1990s, a second wave that began in 2010 with rapid increases in overdose deaths involving heroin, and a third wave that started in 2013 and involved the illicitly manufactured and highly lethal drug fentanyl. As you also know, the U.S. Department of Health and Human Services has declared the opioid crisis to be a public health emergency. Related to this crisis, last year, Pennsylvania tragically led the nation in the total number of deaths due to drug overdose. Pennsylvania also leads the nation in the number of men aged 21 to 30, which is one of my focus areas of my research. In that age group, we lead the nation of people who have died from drug overdose. Now, I have shared this story with you because if there is anything I have learned through my years as a mental health professional, I know that opioid addiction and death by overdose is a complicated matter that warrants the type of focused attention that this conference will provide today. So I am here to not only welcome you, but also to applaud you for your efforts. And I want you to know that my colleagues and I here at Penn State Harrisburg are eager to partner with you to address the serious social, health, and legal problems associated with death by opioid overdose. And that commitment is best expressed through the service provided by the Douglas W. Pollock Center for Addiction Outreach and Research, which is right here at Penn State Harrisburg. So I thank you for joining us here today for this careful examination pertaining to the opioid crisis. And I ask you to give me a warm welcome to my colleague, Dr. Weston Kensinger, who is director of the Pollock Center and who also has a few comments to share with you at this time. Thank you.
Thank you, Mark. As Mark mentioned, my name is Dr. Weston Kensinger, and I'm the director of the Douglas W. Pollock Center for Outreach and Addiction here at Penn State Harrisburg. As we all know, the current opioid epidemic has highlighted the need to adapt and change how we approach, view, and treat addiction. through implementing warm handoffs in hospitals, harm reduction programs, equipping first responders and community members with Narcan, expanding access to treatment, establishing helplines and take-back programs, making data readily available, reducing stigma. The list goes on and on. Right? But we are trying to make a difference, and we are slowly gaining ground in this fight. Throughout Penn State, we're bringing together researchers from all 24 campuses together to consolidate resources and address the opioid crisis and larger problems of substance abuse in Pennsylvania and throughout the region through the Consortium to Combat Substance Abuse. This consortium brings together the best minds from our academic units, outreach and extension offices, medical college, and law school to develop and implement effective programs, policies, and practices aimed at preventing addiction and its spillover effects on families and communities. In August, Penn State Harrisburg established the Douglas W. Pollock Center for Addiction Outreach and Research. This center is equipping the community organizations and veteran groups with the resources that they need so that they can be the difference makers in their communities. On behalf of Penn State Harrisburg, the Consortium to Combat Substance Abuse and the Pollock Center, I'd like to welcome you all to Penn State Harrisburg and hope that when you leave, you're better prepared to be part of the solution. Thank you.
Good morning. My name is Leo Beletsky. I'm on the faculty of Northeastern University School of Law and School of Health Sciences, and I'm a director of the Health and Justice Action Lab, which is one of the co-sponsors of today's proceedings. I wanted to first extend a warm welcome to all of you, and also a thanks to our hosts, to Penn State, as well as to thank our partners in organizing today's proceedings. Bonnie Hoffman from NACDL and Kate Bolton and her team from Vital Strategies. So thank you so much for helping make today a reality. Really appreciate it. So the Action Lab is basically a public health think tank that tries to address overdose and other issues relating to addiction and criminal justice from a public health perspective. And our interest in the issue of drug-induced homicide or drug delivery resulting in death stems from our efforts to address the issue from a public health perspective, where the focus has been on all of the strategies that Wes has just described, including harm reduction, improving access to treatment, improving structural support for people struggling with addiction, and really trying to flesh out what does it mean to implement the mantra that we can't arrest our way out of this problem, which is often now repeated. Our efforts are also guided by the reality that in many ways, this rhetoric around we can't arrest our way out of this problem is simply rhetoric. And today's proceeding is really focused on one illustration of that, which is a huge rise, a surge in laws relating to drug delivery resulting in death, and a huge surge in prosecutions. The reason why we're here today is because Pennsylvania is ground zero for this. So the mass incarceration machine has really ramped up in the context of the overdose crisis, and has essentially put a lot of you who are down there, in the trenches trying to fight this fight against a huge upsurge in punitive approaches, prosecutors essentially centering themselves in response to this crisis and saying, we're going to solve it by doubling down on what hasn't worked for the last 20 years. So our interest in this issue is looking at the national picture where this is happening all over the country, with Pennsylvania as a key sort of ground zero for this issue. But my personal interest is also related to my own family struggle with addiction, family members struggling with addiction, friends struggling with addiction and succumbing to overdose. And this is something that drives a lot of the punitive approaches, because prosecutors are essentially harnessing tragedies to turn tragedies into more tragedies. So instead of one family losing a family member, several families one family losing a family member to overdose, and then another family losing a family member to being incarcerated for many, many, many years. So using personal experience of addiction and overdose to implement constructive solutions is exemplified in my mind by the work of Representative Sarah Innamorato, who's here with us to provide some introductory remarks. Sarah is very public and one of many very inspiring voices in Pennsylvania, trying to turn a personal experience of family tragedy into something constructive. And I wanted to provide her with some opportunity to talk to all of you about constructive solutions to this crisis rather than punitive ones. Thank you.